This is a patient coming with chest pain. Troponin was positive. This is echo in non-STEMI. And echo in non-STEMI is not just about enzymes. The echo tells a story of mechanics, valve, and pressure. These things to assist. We will assess wall motion and some valve. Look at the left heart. The LV is dilated. The left atrium is even more dilated. This is not an acute finding. This is chronic. We will make a Doppler. So after putting a Doppler, color Doppler, what will you see? There is mitral regurg. Actually, this is chronic mitral regurg as LV is dilated and left atrium is more dilated. So this patient with non-STEMI is decompensating a pre-existing problem. Now we gonna look at the motion. Watch the apex. It is not moving at all. That's a kinesia. Now, what about the septum here? The distal septum. This is hypokinesia here. Now, the lateral wall. Hypokinetic. And the basal segment, whether septal or lateral wall, looks good. So we can say apex and septum related to LAD artery. Knowing that a patient is non-STEMI, so these segments stunned, not dead. This is stunning myocardia. Now we're gonna assess the mitral regurg by Doppler. Putting continuous wave over mitral valve will make this Doppler. We have to notice the jet density, not the value. The density is dark and filled in. That means a large volume of blood regurg. And now you have to notice the duration of the jet. It's hollow systolic. Last the entire systole. So that dense plus hollow systolic equal mitral regurg, which is severe. The peak velocity does not matter in the regurg. We can notice that jet of E wave of the mitral valve, which correspond to the diastolic function, and we cannot see the A wave. A wave within the atrial contraction. So this patient may have AF or just a kind of impaired LV diastolic function and increased left atrial pressure as the E wave take the whole diastole. Now color over tricuspid valve and then continuous wave. Look at the tricuspid regurgite. The peak velocity is was just like 1.8 meter per second. That's less than 2.5, so that's normal. That means when we want to calculate the RV systolic pressure, it will be below 35. That means no pulmonary hypertension. That's anterior and inferior, and that's anteroseptal and infralateral. It's apical 3, anteroseptal and infralateral. That is subcostal view. So we want to make a summary for this. LV and left atrium dilated, that means chronic disease. Apex are kinetic and septum hypokinetic, that means LAD territory over non-STEMI. The mitral regurgite that we look here, the mitral regurgite was dense and hollow systolic, that means severe but chronic mitral regurgite. And regarding the tricuspid regurgite velocity was 1.8. That at after calculating the RV systolic pressure means it excluding the pulmonary hypertension. Thank you.